One of the tests that we do in the Bale-Dineen method is the carotid intimal medial thickness test. This is a simple ultrasound test to look at the lining of the blood vessels of the carotid arteries. The reason that we use the carotid arteries is because the carotids are really the last blood vessels to be affected by atherosclerosis. The coronary arteries are affected much earlier, so we use the carotids as a surrogate for the coronary arteries, because if there's disease in the carotids, most assuredly there's disease in the coronaries. This is a simple ultrasound test. It takes about 30 minutes to do in the office, and it's painless, and it shows us the lining of the blood vessels. We can actually see up to a 0.2 of a millimeter change or increased thickness in the lining of the carotid artery, which would tell us that you have evidence for atherosclerosis. We can see small plaques that would not be causing any trouble with the blood flow in the arteries, as would be detected with other tests such as a carotid Doppler test that's frequently done in the hospital. So what that looks like in the arteries is the artery has a one-cell thick lining called the endothelium, and under that endothelium is the intima, and that's where the blockage can develop. And as you can see from section to section here, as this middle part here gets thicker and then develops the cholesterol plaque in it, which can eventually get to be very severe and actually block the flow through the artery. And then the ultimate event is that that lining over that cholesterol plaque ruptures, a blood clot forms inside the artery and totally occludes the blood flow to the artery and causes the heart attack or stroke. So once we know that you do or do not have disease in the carotid arteries, we can be more certain about how we're going to treat you. If there's no evidence of disease in your arteries and there's no evidence of inflammation underlying that disease, then we can say that things are fine for now. We'll maybe check a carotid intimal medial thickness test on you again in a year. If there's evidence of disease, then we're going to aggressively go after that disease, and then we're going to try and put out the inflammation in the arteries so that you do not have any progression of your underlying atherosclerosis.